Hello, my name's Nick Malaband. I'm the Divisional Director of Medicine here at Doncaster and Bassetlaw. One of the projects we've been excited about this year is bringing a hospital at night task management system called Nerve Centre to the hospital.
Nerve Centre's coming live in the next 2 weeks, and it's going to revolutionise how out-of-hours care is provided within Doncaster and Bassetlaw Trust. We've already started this in Bassetlaw over the last year and have had some great successes with both satisfaction from the nursing staff and the clinical staff on the wards. And now it's time to roll it out to Doncaster. What's going to happen is we're going to provide a task management system that's going to go to mobile phone devices, with the clinicians being able to pick up non-urgent tasks from there and to prioritise their workload so that they can be the most effective during that period of time. The satisfaction from the Bassetlaw nurses staff has been great. They've been able to reduce the amount of time requesting jobs from junior doctors, and this has meant that they're able to care for the patients that they need to do. As a medical registrar and part of the on-call system, both out of hours and in hours, I've found that the Nerve Centre system for me has been invaluable. I'm able to keep an eye out on the acuity on the wards and ensure that any acutely unwell patient is identified to me immediately so that I can act and help delegate the jobs amongst my team to the best of my ability to ensure safe care for those patients.
Following successful implementation of Hospital at Night at Bassetlaw, we're now in a position to roll out at Doncaster. What this means for staff is that it's a safer system to alert doctors in the out-of-hours period. So it doesn't replace the current fast bleep system or cardiac arrest bleep, but for anything what's non-urgent in the out-of-hours period, we would use this electronic system. It's quick and easy to use. It probably takes about 30 seconds to input a task. As soon as it's been inputted, it creates an audit log. So it's really been welcomed by nurses, and the speed that nurses can access the system and raise a task has been welcomed by the staff at Bassetlaw. As the role of a coordinator, it gives me the opportunity to see the acuity on the whole of the site, so I can move resources from an area where they're not as busy to an area of high acuity. So this improves the doctor's working experience and gives me a visual of what's happening overnight. So Hospital Out will be used in the out-of-hours period, so this starts at 5 o'clock and goes through to 8 o'clock in the morning, but it'll also be used at weekends and bank holidays.
To request a non-urgent task, a member of the ward staff will access the form on the desktop and fill out the appropriate details. The task will come across to the coordinator, who will then allocate it to the appropriate clinician. Finally, the clinician will receive the task and close it when completed.